Hello students, this is Miss Bracken and I'm going on to Unit 2B, and this section consists of upper airways as well as lower airways. I just want you to make a special note that the upper airways will actually be the conclusion of our Unit 2 exam. So all the materials from 2A, 2B only up until upper airways. Lower airways are actually going to be on your midterm. So keep that in mind. I'm actually going to give you another review for you to have to go over the information and study from for your midterm exam. So keep that in mind. Lower airways is midterm, upper airways is the conclusion of Unit 2 exam. So let's just go into, if I can get my computer to work here, our first objective, which is objective 10, and we're going to identify the anatomy and function of the upper respiratory tract. So the upper respiratory tract consists of nasal and oral cavities, the pharynx, as well as the larynx. Now, all of this information I want to also point out on your review. This is going to be questions 47 through 61. If you wanted to kind of follow along and make notes and then go back and answer your questions for your review, which is optional for you to turn in on the day of the test for Unit 2, which I believe is on the 26th. Okay, let's continue. We said the upper respiratory tract consists of 4 different things: nasal and oral cavities, the pharynx and the larynx. And then the upper respiratory tract performs 4 important respiratory functions. The first thing it does is it conduct and inspire gas, filter inspired gas, humidify inspired gas, as well as warm inspired gas. So the nose, pharynx, larynx conduct, inspire gas. So all of those 3 areas are used for the conduction of gas. So the primary function of the nose, though, is to filter the upper respiratory tract. We know that it filters because when we get too much in our nose, we sneeze, right? And the nose blows all that stuff out, whatever it is that's in there that's irritating the passageway. So the main primary function of the nose is the filtering of the air for us. The nasal passages also are responsible for humidification and warming of inspired gas. When we have a patient that's intubated on a ventilator, they can no longer breathe through their nose because the breathing tube is in their mouth. So we have to artificially put something in place to make sure that the body stays warm. And we call it what can be thought of as an artificial nose, but it's called a HME, or humidified moisture exchanger. You'll learn more about that in mechanical vent class, but because we cannot naturally filter, warm, humidify our bodies like we need to, we have to do it another way, artificially, through the machine. So the nasal passages filter, humidify, and warm. Adults normally breathe through their nose. Babies sometimes tend to do a little more mouth breathing, but conditions like nasal polyps and mucosal edema can sometimes prohibit nasal breathing. You have patients that have deviated septums, things like that. That sometimes can cause them to snore or have artificial problems with their breathing just because of their nasal passages. High velocity flow rates, such as during exercise, may cause mouth breathing. I think a lot of us, just to make it easier without thinking about it, when we're exercising or doing something that's very exertional, we'll breathe through our mouths, because especially in patients with excessive nasal resistance, like I said, with the deviated septum. The normal nose warms the inspired gas close to body temperature and saturates it with water humidity, just naturally, before the steam arrives at the nasal pharynx. So, moreover, on expiration, condensation of water vapor retains both heat and moisture for subsequent modification of inspired gas. And I've already touched on the artificial airways, how we have to put some type of humidifier in place artificially to warm the gas. I'm not going to go back into that again. Now, the defense function of the nose involves both physiological mechanisms. The large hairs of the vestibule provide a gross filtration system, which we already talked about that, and that's where the nasal hairs come down. The function is augmented by the nature and pattern of the air pattern through the nasal cavity. So the air that flows through the nasal cavity is at a very high velocity, what can be considered turbulent, through the anterior nares, making a sharp directional change as it enters the internal nasal cavity. So if you was to kind of splice this open and look at the way, and I have a video, a picture too, where you can see it. You can see how the air has to go in, and it's like a tunnel through to get down to the area it needs so we can breathe. By this action alone, large particles of foreign material readily impact on the nasal mucosa. So such matter is cleared by ciliary action, or what we do all the time without thinking about it when we sneeze and blow our nose. As the spire gas enters into the main passageways of the nasal cavity beyond the external nares, and I have a picture coming up here shortly, the cross-sectional areas increase, resulting in decrease in gas velocity. However, due to the narrow convolutions of the passages, the pattern of flow remains turbulent. Turbulent meaning fast and a heavy flow. In combination, the relative low velocity and turbulent air flow ensure the foreign particles that escaped earlier will be removed by further impaction. So here you can see in the picture, there's how you would breathe in. Here's the nasal passage, and it has to go through these different areas to go back in this area down to the lungs so we can breathe. So let's talk about the next topic, which is the parasinus area. Parasinuses actually is almost in all the different areas of the front of our face. So the parasinuses are symmetrically paired spaces adjacent to the nasal cavity. So when these sinus areas get clogged, you can kind of feel the pressure in these areas. Even when you breathe, sometimes people get headaches and things like that, but they can feel that sinus pressure kind of causing them some issues. There's 4 areas in the parasinus area. We have the frontal, maxillary, ethmoid, and the posterior splenoid. So let's take a look at those right here. You can see on the face, frontal ones, that bothers me a lot too. And here, especially on the sides here, the splenoid ones get a lot of pressure in the winter time or in the fall when the weather changes, and there's sometimes they get kind of clogged or infected. You sometimes have what we call that facial pressure. But here's the frontal sinuses. Be sure you know these for your exam because you will be tested on these. Ethmoid sinuses right up here in the nasal area. Splenoid, which is more on the cheek area. Well, I'm sorry, the maxillary, and then the splenoid is right under the ethmoid. So all of these parasinuses are named for the bones in which they occur. Okay, so most of these sinuses open into the nasal cavity between the turbinates. So they all kind of lead down to one area down in the nose area. Where the turbinates is where the air comes in, as we just said before. The purpose of the sinuses are unclear, but may provide temperature insulation, strengthen the skull without additional weight, and enhance our voice resonance. I know sometimes we get all plugged up. Sometimes some people sound a little nasally, and that makes perfect sense when we say that it kind of can affect our voice. Problems that can occur when drainage of the parasinuses become impaired, well, some people get what we call chronic sinus infections are a source of contaminated materials that may be aspired into the lower respiratory tract. So if you was to blow your nose and you blow out yellow or green, that's a sign of infection, and you can't inhale that down into your lungs. And they have a respiratory infection also in your lungs. So this is one of those things to kind of pay close attention to when you have head colds and things like that, that it doesn't get too terribly bad that you may need antibiotics or let it go so far without getting some kind of treatment, because it can get into your lungs and make you really bad or maybe even turn into a pneumonia. So here's another picture of the sinuses from the side view. You can see the splenoid, ethmoid, the frontal ones, and then the maxillary. Okay. As we move on, we're going to look at the oral cavity. The oral cavity serves multiple purposes. Number 1 is digestion. Secondly, to help us with our speech. And then thirdly, ventilation. So the oral cavity is considered an accessory respiratory passage. In adults, Mouth breathing is used during speech. We do it without thinking about it. We do it with strenuous exercise. When we have a head cold and maybe our nose is plugged, we breathe through our mouths without even thinking about it. It's just automatic to start breathing through your mouth. It's just the path of least resistance. So when we get infection or foreign matter and obstruct our nose, we start breathing through our mouth. So it's like a secondary backup for our breathing. If you can't breathe through your nose, you automatically go to your mouth. Palate. The palate separates the nasal cavity from the oral cavity. And the anterior 2/3 of the palate has a bony skeleton and is called the hard palate. And I have a picture here to show you in just a moment. So the posterior third of the palate does not have any bony structure, and it's called the soft palate. I skipped ahead, but the anterior 2/3 of the palate has a bony skeleton, and that's called the hard palate. So when you think of your mouth, at the very top, it's kind of the hard part, and then off back towards the back side, it's like a soft palate. So the uvula extends from the midline of the soft palate and controls flow when eating, drinking, sneezing, coughing, or vomiting. So these are the things that we do, and when we do these different functions without thinking about it, and these things in our mouths are already set up by the good Lord to do what it's supposed to do as we eat, drink, swallow. If we vomit and the liquid's coming up from the back way versus going down from the front, our body knows how to open up and let all that out. It's just amazing. So here's a picture. See here at the top is the hard palate, and then down here is the soft palate, and then we got the uvula in the very back. You see your tonsils, which is right there, and then on the whole very back there is with the start of what's called the oral pharynx. Now we're going to go into the tongue. Not too much more in this section. So the tongue, we know, is involved in a mechanism or mechanical digestion, taste, and phonation. So it helps us when we're trying to chew our food, to taste our food, and it helps us with our speech, right? So the posterior surface of the tongue is supplied with sensory nerve endings. These nerves produce a vagal-gag reflex when stimulated. So if you have some water, you drink and it goes down the wrong pipe, these little vagal reflex things kick into place, which helps protect the lungs from aspiration. Aspiration means you drink something, and instead of it going into the stomach, it goes into your lungs. So some people get what we call aspiration pneumonia because they drank some liquid, it went to their lungs, and then it turned into an infection. That's not a good thing, but just so you kind of know what the term aspiration is and how it's used. So you can see here in the picture from the side view, the turbinates, the nares, hard palate back there, oral cavity, the big tongue. It looks very big in this picture. And then you can see there's two areas here. So you got the area that goes down into the stomach, and then you have the area that goes down into the lungs. So the lungs, the opening when they put a trachea in is right in the front here. So this flap goes over, and we'll talk about that in a little bit. It protects the lungs from fluid and liquid when it's functioning properly, and then the food goes down into the stomach like it's supposed to. So this is the esophagus. Here is the trachea. Okay. So let's talk a little bit more about the oral cavity. And I think I'm going to maybe even break this video up into 2 sections, just in case you want to come back later and watch some more. So it's not so much all at once. Break it up into 2 sections here. Okay. So oral cavity, the mucosal surfaces of the oral cavity provide humidification, warming of inspired gas. Less effective than the nose, though. It doesn't do the job the nose can do. The nose does a better job. Saliva, which we know is in the oral cavity, is produced from major and minor salivary glands. Okay, so these saliva glands function as wetting and digestive agent for the food. It helps to break it down, but provides humidification of inspired gas. So it does humidify, helps warm some things, but not to the degree of what the nose has been intended to do. The oral cavity ends at the palatine folds, and the palatine tonsils sit between these folds. So you can see here in this picture, again, the hard palate, the soft palate, the tonsils, the uvula, and then the oral pharynx is in the back. We have to know the anatomy of the mouth because when we do intubations, you have to be able to look inside the mouth and know where you're going with the ET tube, endotracheal tube. So we have to kind of know what's all the features of the mouth. I think I'm gonna do one more here, and then I'm going to end this video and then start up another one. This is the pharynx. The pharynx is divided up into several segments. The pharynx, in definition, extends from the nasal cavity and the mouth to the point where the airway and digestive tract separate. So, three segments of the pharynx. You got the nasopharynx, the oropharynx, and the hypopharynx. Okay. So the pharynx is lined with the stratified squamous epithelium. Every area in our body, actually on the inside, has some type of tissue or muscle that lines it. That's what helps to make it flex and contract and all that stuff. You got to have something there. So the nasopharynx lies behind the nasal cavities, and the muscles of the palate occlude the pharynx during swallowing and coughing. So it kind of has a little flap that goes over, and I'll show you that a little closer here in a moment. So the excretion tubes open into the lateral nasopharynx. These tubes connect to the nasopharynx with each middle ear and with the mastoid sinuses. So the adenoid tonsils are located on the posterior wall of the nasopharynx. So it's just giving you a little breakdown of the anatomy on the inside. If you was to look around, this is kind of the layout of what you would see. So the oropharynx is in the back of the oral cavity and extends from the uvula to the epiglottis and the base of the tongue. The other name for oropharynx, and you need to know this also, is that there's a hypopharynx and there's a laryngopharynx. Both of these are the same thing. So if you see laryngopharynx on the test, it's also what could be called the hypopharynx, okay? So the hypopharynx is the inferior portion of the pharynx between the epiglottis and the larynx, and it's called, there you go again, hypopharynx and laryngopharynx. Either one of those fit that description that I just spoke about. And you can see here on the diagram, let's find there's the laryngopharynx right there, also known as hypopharynx. That is a test question. Be sure you know that. Okay. On that note, I'm going to stop right here, and I'm going to make a part 2 of this video just for the sake of time, in case you don't have much time to sit in one sitting to watch it all. Okay? So please join me back for the second part of 2B.